Bladder problems can significantly impact your life. You can start figuring things out at home by completing a voiding diary. All you need is a measuring device and a piece of paper or an Excel spreadsheet. For male anatomy, usually a urinal is used, or for people who sit to void, a urinary hat can be used. Both can be found at the local pharmacy. Ultimately, any measuring device that you have at home will work. So start your chart like this. You'll need to know what happened throughout the course of the day. Start first when you wake up in the morning and document whether you're awake or asleep. So sleep is considered any void that occurs after you fall asleep, including the first morning void. Circle any voids that occurred during sleep and total them together. It's also important to note whether you took certain medications like a water pill called the diuretic, time of day, how much you urinated each time, what you drank and how much of it, and whether you had any accidental leakage. If you do leak, try to estimate the amount of leakage, whether you had a strong urge or whether you were coughing or lifting, what you were doing. Units of measure should be consistent. You can use ounces, which add up to cups, pints, or quarts, or milliliters, which are the same thing as cc's. 1 ounce is 30 milliliters, and there are 1,000 milliliters in a liter. A liter is pretty close to a quart. So a normal bladder will look like this. Normal bladder volume is approximately 300 to 500 milliliters, but it varies significantly. Normal 24-hour urine volumes range from 1.5 to 2.5 liters. That's about 1.5 to 2.5 quarts. A liter is approximately 1 quart. The amount of urine you produce during sleep should be less than 35% of your 24-hour urine volume. That's why it's important to start when you wake up in the morning. You can also see that this person drinks mainly water but had 1 coffee and 1 wine that day. So normal frequency is considered to be 6 voids in 24 hours, but for someone who has coffee who voids 7 to 10 times, I would consider this relatively normal and expected. So this voiding diary shows frequent voids. If yours looks like this, the most important thing to notice is how much coffee, diet cola, tea, and wine this person is drinking. Those are all known bladder irritants. They're also drinking high volumes of fluid, a total of 3,000 milliliters, 3 liters. Notice if you're eating watermelon or boiled broccoli or soup because this increases the fluid for the day. And this person might be cured by simply changing what they are drinking. This person, however, has normal fluid intake, primarily water. In fact, they're not drinking enough, 1.3 liters. This is lower than the average fluid intake for the day for people. What's impressive is how small these voids are. 100 milliliters is approximately 3 ounces. The 24-hour urine volume and the nighttime percentage of that volume are normal. But this person should talk to their doctor. You can imagine what it would feel like to go every 30 or 60 minutes throughout the day and night. So maybe they should even see a urologist. Either they have a very small capacity bladder, or when they urinate, they're not actually emptying their bladder. It's easy to determine how well the bladder is emptying. We do this by measuring the post-void residual, which assesses the amount still left in the bladder after urination. So the image on the left, you can see the bladder scanner, which is simply a non-invasive ultrasound device that gives a picture and calculates how much is left in the bladder. Or this can be determined directly by catheterization. Usually we use ultrasound because the catheterization is slightly uncomfortable. Now, if your bladder is not emptying when you urinate, improving this emptying will reduce your frequency of needing to void, and also other complications such as urinary tract infection and incontinence. Now, this person has large infrequent voids. We see this kind of bladder in people who have to hold for their work, for example, a teacher, a surgeon, a truck driver, a nurse. Urinating this infrequently can become problematic if somebody is having urinary tract infections or leakage. But if there have been no problems, usually there's no reason for concern. Talk to your primary care doctor if you worry about other factors in your specific case, such as kidney function. This is a special situation where the person has high nighttime urinary volumes. That's called nocturnal polyuria. So you can see relatively normal infrequent voids throughout the day and normal fluid intake with basically water, but at night there are multiple high volume voids. In fact, the urine produced at night is 50% of that produced during the 24-hour day. more than the normal of 30 or 35%. So this term is called nocturnal polyuria. This person drinks a little bit more fluid right before bed, which can be important, and they might also be getting leg swelling during the day. Fluid in the ankles can go back into the bloodstream when the legs go up at night. If you think this might apply to you, try elevating the legs above the level of the heart for an hour before sleep, and then go empty the bladder before dozing off. See if that helps. If you have increased nighttime urinary volume, more than 30-35% of your 24-hour, try the trick of elevating your legs for an hour before sleep, then emptying the bladder. Also check whether you're taking any water pills called diuretics before bedtime. Ask your partner or friend to tell you if you snore loudly or are having breathing issues suspicious for sleep apnea during your sleep period. Evaluate how much you are drinking before bedtime, how much salt is in your diet, because high salt can cause increased nighttime urinary volumes. And also ask your doctor about kidney and heart issues that can lead to nighttime voids if none of the above indications work for you. Ultimately, avoiding diarrhea is a helpful home assessment tool for bladder problems. We've talked about a couple of home remedies, such as bladder irritants and nighttime urination if you have leg swelling or eat too much salt. But if you're avoiding diarrhea and these interventions don't lead to improvement in your symptoms, speak with your provider about what else might help. For example, assessing for a post-void residual urine volume, trying pelvic floor physical therapy, treatments for overactive bladder, or testing such as urodynamic testing. I hope this helps. Thank you.